Hello, we're Simulation Sense, and we're teaching doctors diagnostic skills through digital simulation. My name's John Holcroft. I'm a software engineer and a usability designer. I've also written clinical guideline applications which are used in a range of hospitals, and just recently I won an International Innovation Award for advancing patient safety.
And I'm Michael. I'm a junior doctor, honorary clinical lecturer at Imperial College, and last year worked as a teaching fellow at Charing Cross Hospital, where I taught medical students the skills they needed to diagnose and treat patients. If you've ever had a doctor look in your ears, they'll probably use one of these. It's called an otoscope. Medical students will practice using one of these, usually on each other. And a lot of them have normal looking ears. So the problem with that is that they never get the experience of looking and diagnosing ear conditions. Now, fast forward 10 years, that medical student becomes a doctor. They're a GP. If you take your child who has an ear infection to see that GP, the chance of them diagnosing that ear infection is only slightly higher than tossing a coin, with 53% of ear infections being diagnosed correctly.
And this is the problem we're looking to address, that translating the theoretical skills, from knowledge from lectures and from textbooks, to where you really require real-world practical skills. There's a classic phrase which describes this brilliantly, which is, I read and I forget. I see and I understand. I do. Let's try it again because I completely faffed it. I hear and I forget. I see and I remember. And I do and I understand. And we take that, let's look practically at that in terms of learning to diagnose ear conditions. Now, Michael's own experience, and that from all of the doctors we've spoken to and to the consultants, they've said the same thing. The textbooks in this are fantastic. The knowledge in them is amazing, but it just doesn't stick. Now, all the doctors say that they really learned how to do their jobs by seeing patients. And just looking, if it comes to this case of ears, looking in lots of different ears. But how do you get that experience before you see the patients? Well, Michael and I met at an NHS hack day in Cardiff back in January, where we built an Otoscope Simulator. So by using the motion sensors on a phone, you could move your phone and it would be just like looking through an otoscope, and you could then see all the various ear conditions that you would struggle to be exposed to. Now, through this program, we realized that it's actually far huger than we initially imagined. There's really three main areas of simulation. The Otoscope Simulator is in the thing of sight and sound, where you have to experience something to learn it. So it'll be like looking in an ear, looking in an eye, down a throat, hearing chest sounds. Again, things you have to experience. But say if you go to surgery or to doing a physical procedure like, say, inserting a chest drain, in that case, what people really like or what they really need is a visual checklist. So this is seeing the procedure in steps as you would experience it yourself.
And finally, one of the best ways that simulation training can be used is simulating the entire patient encounter, from starting with a symptom such as a patient who has chest pain or shortness of breath, making a diagnosis and managing them. And the student can see exactly what happens to the patient's health with their actions. This kind of training already happens in medical schools and teaching hospitals, in clinical skills labs. But the problem is these labs are largely inaccessible, with junior doctors only having access to these simulated environments 1 or 2 times a year. We think that better simulation training can have a better improvement in clinical outcomes and reduce the £57 billion paid out clinical negligence in the US and the UK. The estimated size of the medical education simulation market is £900 million. But if you take at the local level, Junior doctors have a £600 training budget, which they spend on their medical training. And with 54,000 junior doctors, that's a market of £32 million.
So where we're at now is that our fundamental vision is that there needs to be training given to doctors and other healthcare professionals when they need it, as they would experience it. And we're working very closely with Frimley Park Hospital and Charing Cross Hospital to find out exactly where best to apply this next.
We're Simulation Sense. If you'd like to hear more about us, our stand is right at the back of the room. So come and have a chat.